So maybe we're going to get going. I'm Connie. I'm with the Continuing Education Committee with the ABVTA, and you obviously all know how this works. This video is being recorded for your continual enjoyment and learning. So please type your name, first name and last name in the chat, or you will have to take a test in order to get credit for this. So yeah, now we are so lucky tonight. Dr. Nick Nation is likely the most knowledgeable veterinary pathologist in all of Canada, if not all of North America. He's also a fabulous presenter. We are really lucky to have him speak with us tonight. Let me provide just a little bit of background. Dr. Nation graduated with his DVM from WCVM, then went on to complete a master's in veterinary science and veterinary pathology at the University of Saskatchewan. He then worked as a veterinary diagnostic pathologist for Alberta Agriculture, working pretty much all over Alberta for 17 years. During this time, he also completed his specialty in veterinary pathology. And if that wasn't enough, he did a PhD in neurotoxicology at the University of Calgary in the Faculty of Medicine. Fortunately, Dr. Nation then came up to the University of Alberta, the best university in Alberta, maybe not for veterinary medicine, but he became a veterinary pathologist for the Health Sciences Lab Animal Services and also became the director. At the same time, Dr. Nation started a private lab, VPL, which eventually, after working through some other groups, became part of IDEX. So we can thank him for all the learning that all the people he's taught. We can thank him for providing all these great labs. And then he even went on, after leaving the U of A in 2005, to start yet another lab, Animal Pathology Services, a private consulting practice in veterinary pathology. Now, Dr. Nation claims to have just retired, but he is an adjunct professor in the Faculty of Medicine and Dentistry and participates in cancer and pediatric research. And he's doing a fabulous, he's going to start a fabulous project of archiving hundreds of thousands of great slides and pathology samples for everybody to enjoy from now on. I don't want to take any more time, but I could go on forever about Dr. Nation, but I'd really like to welcome him and thank him for coming and speaking with us tonight. So I'll turn it over to you, Dr. Nation.
Okay, well, thanks very much, Connie. That was quite an introduction. I'm not sure I can live up to that, but anyway, we'll see what we can do. I'm just going to start sharing my screen here, and we'll start off here with our first slide, and I'll just make a few introductory comments. And can everybody see that? Any feedback, anybody?
Yes,
it's perfect.
Okay, great. Thanks very much. Okay, just a couple of introductory comments. First of all, I'd like to make a comment that my internet sometimes is unstable, and I'm not sure whether out here in the far south edge of Edmonton we don't pay our taxes or something, but every now and then it'll go down. If that by any chance happens tonight, hang on, because it usually comes back within a minute or so. So don't give up in disgust. I should be back. Also, I am going to be covering a lot of ground, and I'm going to be very happy to handle any questions this evening. Unfortunately, I can't see the chat while I'm doing the screen sharing here. And so I'm going to perhaps find a natural stopping point about 45 minutes or an hour in. We'll do some questions and discussion, and then continue on with the rest of the program, depending on how long that takes us. I've entitled this Preparing Clinical and Necropsy Samples for Laboratory analysis. But I'm also going to talk about some of the background to preparing samples, why to prepare them, how to prepare them. And one of the important things is how to use the laboratory. I'm going to make quite a few comments about that as well. Now, you don't have to take notes for any of this. It is being recorded, and that's great, but everything that I'm going to talk about and quite a bit more is present in a manual that I wrote several years ago, and it's available from the UCVM Diagnostic Services Unit website. This is the link, and I believe Connie is going, or Vanessa are going to send out the links and information on the manual with your CE credits. So again, you probably don't even have to bother copying this down, but you can access the manual and download it if you want from this particular URL, or otherwise Google the DSU UCVM. That's the Diagnostic Services Unit UCVM. That'll give it to you as well. And that particular manual actually covers much more than what I'm talking about tonight. It goes step by step through animal and avian, mammalian and avian necropsies, and it's intended to be an in-depth guide for veterinarians and for veterinary technologists in the use of pathology and the performance of pathology. If you Google DSU at UCVM, this is what will come up. Services Unit. You then want to go to the Protocols tab on that line, and so hit the Protocols tab, and the next thing that will come up is their information on postmortem sampling. Go to the bottom where it says Necropsy Manual, and if you click on Learn More, that will give you the manual. So that's those are the notes, and everything I'm going to talk about tonight is in there. This is what it looks like. Very, very plain. It's nothing fancy. That's the first page. So before we talk about laboratory sampling and preparation, I want to talk a little bit about a couple of things around necropsy. And one of the things that really concerns people, particularly newer technologists and veterinarians, is the animal dead. And that's not always easy. And I wanted to point out a couple of points. There are, of course, lots of ways of telling, but there are a couple that I think are quite important. The first one I've noted here is active versus passive bleeding. An animal that is still alive actively bleeds. In other words, blood will pump out of arteries, arterioles. There will be evidence of blood pressure. That animal is still alive. May not be conscious, maybe in rough shape, but it's still alive. Passive bleeding is the type of bleeding that occurs when you start to do a necropsy and blood comes out of the tissues as you cut blood vessels, particularly as you cut major vessels. You'll sometimes get quite a gush of blood, but it is not under any pressure. There's no spurting, there's no arterial action. It's just the result of the major vessels that are relaxing, releasing the blood that's in them. And so passive bleeding is a sign of an animal that's dead and not a sign of an animal that's still alive. Pallor, of course, is characteristic. A whitening or even a bluish color of mucous membranes of the skin of those areas that you can see. Dilated fixed pupils without any reflexes, indication of death. Very often when an animal dies, sphincters relax and they urinate involuntarily as the control of the bladder sphincter is lost. They will lose urine. and here are the two things that really upset people. One is that there are muscle fasciculations. If you have an animal that's just euthanized and you're doing a necropsy right away or collecting samples right away, you'll often have a lot of twitching of the muscles. But this is uncoordinated movement. It's not able to direct any movement of limbs or whatever. It's just twitching of muscle, and it's due to the amount of ATP that is still in the muscle tissue. So don't forget that although an animal has died, not all of the organs have died. In other words, they still are capable of some metabolism. The excitable membranes, such as those of the nervous system and the muscles, are still able to depolarize until such time as they use up their reserves of ATP and other energy producing enzymes, and they are capable of repolarizing. The key is that these fasciculations or involuntary movements decrease quite rapidly with time as the muscle reserves are being used up. But if an animal twitches, that doesn't mean it's alive. The other thing that happens is unexpected movements, and these occur when major nerves are cut. For example, if an animal has recently been euthanized or recently died, and you're doing a necropsy and you cut, say, a major nerve, femoral nerve, sciatic nerve, brachial nerve, you'll often get an involuntary twitch of that leg. And some, in large animals, cattle and horses in particular, that can be quite a significant kick actually that occurs. But it's due to a sudden depolarization of a major nerve trunk as you cut through it. It's not a sign that the animal is alive. If at the same time you've cut that nerve trunk and you get active arterial bleeding, blood spurting out, then that animal is alive, and that's a whole different situation. One other thing that really causes people consternation in lab animal work, and this is, you should be aware of if you're working with pocket pet species or particularly rodents. Rats will occasionally actually sit up when you're removing their internal organs. They can have been dead for I've seen it happen as long as half an hour. And some of these animals have all of the internal organs removed. For example, in drug studies where you're taking 10 or 15 or more different samples for examination, you'll have an animal that's almost got no organs left in the abdomen or thorax, and it'll suddenly sit up. That is an extremely disquieting thing. The animal is dead. It's a reflex. It's very rare, but I wanted to mention it in case it ever happens, so that you're prepared and not unduly upset by it. So having said that, I just want to talk a little bit about the tools that you might use for, I put for postmortem here, but this also is really applies to tissue collection more than it does for postmortem. First of all, for collecting tissues and sending them off to a lab, you don't need a complicated set of tissues, a complicated set of instruments, but you do need quality. I call them leftovers. What people often do is they have an old dissecting kit from when they were in university, and when they get to the vet clinic, well, that's just tossed in for the necropsy because necropsy and tissue collection, the animal's dead. What the heck? It doesn't really matter what you use. And so very often the broken scissors, the dull scissors, the old scalpel blades, whatever is put into the postmortem kit and left to bang around almost like you would in a toolbox. The first step in taking good samples is to have good equipment, and that means surgical quality scissors, surgical quality clean properly cared for scalpels and forceps. And so here's a kind of a basic set of things you might need for large animal necropsy. You certainly need heavy gloves. I'll maybe talk about that in a minute or so. You'll need a good knife and a steel. And I should mention the steel here. You know, you'll see a butcher using a steel, or you'll have a steel for your knife in the clinic. The steel is not used for sharpening the knife. What the steel is doing is straightening the blade. As you use a knife, particularly in a large animal postmortem, but also in other circumstances, whether it's you know, carving meat at home or in small animal necropsy, there will be little irregularities that occur as you hit bones, cartilage, as you go through tissues of different density. And this causes microscopic waves in the edge of the knife. And that makes the knife feel dull. If you straighten the blade using a steel, you actually feel as if the knife is sharper. It's actually not sharper. All you've done is you've lined up the edge so that it's cutting more evenly. If you need to sharpen one of these knives, you need to have a proper stone, and has to be done. There's quite an art to it, actually. I prefer to do it by hand because you can have a much longer lasting blade by hand sharpening, but that's not part of tonight's talk, so I'll leave it there. An axe is also useful in large animal practice in particular, and bone cutters, also heavier tree shears. I often joked when I was doing large animal postmortems that in actual fact, I got more of my supplies from Canadian Tire than I did from WDDC, but that's just the nature of the beast. For small animal work, you don't need too much. Bone cutters, which were in the previous picture, good scalpel, good pair of scissors, and forceps. And I want to make a comment on the scissors and the forceps. Here's another set which I wanted to use to illustrate something. Safety scalpel, of course, more common these days than in the past. The scissors should be good quality, and I prefer a rounded end. Unfortunately, the picture here is on my screen anyway, is cut out by the list of participants, but these scissors have blunt ends. I recommend blunt-ended scissors for this type of work rather than pointed ends, because blunt ends go more easily into tubular structures, such as the intestine, such as the ureters, through the airways of the lungs, and stay in the lumen rather than punching through it. A pointed end, particularly if it's sharp, will go through and cut through the structure, as a blunted end will allow you to incise right down to the end of it. I should say, just to comment on quality, this pair of scissors that I've photographed here is about 25 years old. It's been used for 25 years, and it's still it's never been sharpened. These are still not as sharp as when I first started using them, but it shows the value of purchasing and using good quality surgical scissors. I want to make a comment on forceps. If in the previous picture, if you recall, the forceps were the blunt ones. They had no teeth. Okay, and it's counterintuitive, but the best forceps to use for collecting tissues are tissue forceps with with teeth on them. And the reason for this is that you're going to do less damage to a tissue by holding it gently with tooth forceps than you are by holding it with blunt forceps. The reason for this is that when you have a blunt surface without the teeth in it, you're going to exert more pressure over a larger surface of that tissue, as opposed to having much finer control. You're going to do damage with tooth forceps, but you're going to damage a very small area of the tissue. And one of the principles that I want to emphasize tonight in preparing samples and taking samples for necropsy examination is that the tissue should be handled as if it was a surgical sample, as if it was a live animal. You want to have that sample go into a jar, or that blood sample go off to the lab in as close a state as possible as it was in the animal at the time it was taken, whether the animal is live or died. And so a surgical sample should be as close as possible to what it looked like when it was in that animal. And so you got to handle them like they're surgical samples, as they're handle them like living tissue, and be aware of artifacts that you can induce by not handling properly. Okay, a few other items that I'd like to mention in terms of more for necropsy than tissue collection, but these are a few practical notes. First of all, clothing. In large animal practice, one of the things that is often done in order to keep your arms free is people will cut the arms off their coveralls. And so particularly if you're doing a lot of pregnancy diagnosis or other things where you're washing your arms or your hands all the time, the tendency is to cut the sleeves. For postmortem and handling tissues, you want to have a full sleeve because you're thinking protection now. You're dealing with animals that have died of infectious disease. You may be encountering a zoonosis. You may not know that until after you get lab tests back. So you want full sleeves. You want good heavy gloves. And whether in small or large animal practice, you want a heavier glove than the usual examination gloves. Those are too flimsy. They're too easily torn. And especially if you're doing post-mortem work, you will be encountering bone chips and sharp objects that will tear those gloves. And once again, if you're dealing with zoonotic disease, then you're opening yourself up to possible infection. So a heavier glove, and nothing too fancy. Dishwashing gloves are fine. I find that dishwashing gloves tend to be a little too loose. Mechanics gloves, this is one particular type of mechanics glove. These are quite heavy. They're 15 mil. Just to give you an example, the vapor barrier that's used in sealing houses is 6 mil. So this is more than twice as thick as that. They fit well, but because they're fairly heavy, there's sometimes, if you get one that's too small, a size that's too small, they're a little bit restrictive on your hands. So make sure you get something that fits. But a heavy glove, doesn't matter where you get it from. These mechanics gloves are available, a whole variety of them at places like Napa Auto, Canadian Tire, anywhere that sells auto supplies or oil and oil filters for changing oil in cars. One of the amazing things is that you can, by having your full sleeves and gloves that go up over the sleeve, you can keep the sleeve of the glove in place, usually just with a rubber band. One of the annoying things without taping your gloves is that often they'll ride down, and you'll end up getting blood coming over the top of the glove or underneath the sleeve. Rubber bands are surprisingly adaptable to the movements of your hands, and usually will hold the sleeves of gloves into place. Otherwise, you can tape using any type of tape that's available, and that just keeps them up and maintains a complete continuous barrier to your skin surface. One other thing that I'd like to mention is you want to, especially for the animal health technologists, your often cleaning up as well as helping or collecting the samples. Some type of table cover in small animal work is really useful. And for most small animals, newspaper, thick padded newspaper on the table is great, because once you're finished, you can roll up the animal or the organs, whatever you've been working with, in the newspaper, put it into the biohazard disposal, and you've got a clean table underneath, rather than having to spend your time scraping up blood that has coagulated onto stainless steel tables. Once blood dries on a stainless steel table, it's much harder to get off than if you can avoid it getting there in the first place. There are a number of other things. Lab supply houses also have absorbent plastic backed table covers, and you can buy rolls of that. Using a table cover really helps if you're working at all in laboratory animal work, where you may be taking samples from several animals in sequence. Newspaper is ideal, because you can take samples of the first animal, roll it up in the first sheet of paper, do the second animal, roll it in the second sheet of paper, and so on and so on. Again, for what it's worth, for pocket pets, the Edmonton Sun is a better size than the Journal. So the Sun newspapers are a better size for pocket pet postmortems than the Journal, for just based on their size. Now I'd like to talk a little bit about the mindset that you should have when you're looking at the laboratory and the samples that you want to send to it. First of all, the samples should represent the animal and the disease that you are investigating. So keep in mind that the samples should be reflective of what it is, the information that you need to get out of it. And the way to approach the lab is to think of it as somewhat like a computer. What you put in helps guide the quality of what you get out. So the better the information that you put into the computer, the more accurate, the better the calculations it does, the better the information that it spits out at you. A lab is very much like that. If you think about it, the people that are working in the lab have a lot of technology and a lot of knowledge available to them. But you, as the person sending that sample in, you're the person who saw the animal and can help direct and use that technology by getting everything off on the right foot. So if you're in doubt, always phone the lab. If you've got any concerns about the quality of work you're getting, what you should send to them. Actually, that's really a point worth mentioning. You'll very often go to a textbook, particularly if there's a new or a disease that you haven't seen or don't run into very often in your particular practice. Go to the textbook and you read what Dr. Radis that says you should submit for such and such a disease, or any of the other major veterinary texts. Don't forget that not every lab does all the textbook tests. And so some of those tests may be superseded by others that are more accurate. Certain labs may specialize. For example, endocrine diseases usually only go to 1 or 2 laboratories in North America for specialized endocrine tests. The same for certain types of nutritional tests. Not every nutritional lab does all of the types of things that you want. Toxicology is another example. Not every lab does the whole suite of toxicology that you might like. Phone the lab, find out what they do. The textbook is a useful guide as to what you might want to send in, but check with the lab to make sure that they do it, or that they can send you to somebody who does, because they'll have a lot of contacts. But one of the other things to keep in mind is that the lab is also a very useful second opinion on something. And if you're not getting results from the lab that you think you should be getting, phone up and ask why. And I had a situation many years ago when I was with Alberta Agriculture where I had a phone call from a large animal practitioner, and she was quite irate. This is a really top class practitioner, and she was quite irate because she had been sending samples to the Edmonton laboratory for about 5 years from a particular herd. And the same problem was occurring year after year at about the same time. And there were no pathogens, she was getting nothing on her lab results. And she was quite upset. And so I just let her rant for 3 or 4 minutes. And finally, after she managed to cool down a bit, I said, okay, let's just review. Let's just take another view at this. Let's just review this. This disease has been occurring for 5 years in the same herd at the same time. And in all those years, there have been no positive lab results. I said, maybe you're not dealing with infectious disease. And there was dead silence on the end of the phone for about 5 seconds. And then she uttered a particular expletive, and it hadn't occurred. She was so fixed on this problem being infectious, she hadn't considered that the lab results, the negative lab results, were in fact telling her something. So this is an illustration of 2 points. One is getting that viewpoint from the lab can set you back on a different tack than you were on before. And hopefully it might be a better tack or even the right tack. And secondly, a negative result is telling you something. So don't just look at it and say, oh, it's negative and toss it aside. Think about it, because that means you might want to look somewhere else, particularly if you're looking for infectious disease. So just a couple of thoughts there. I want to talk a little bit through the next part of this talk on various things that we do in pathology. I'm not going to talk about gross postmortem in this case. I'm going to spend quite a bit of time talking about histopathology, because that's one of the most common tests. That and bacteriology, microbiology are probably and hematology would be the most common tests that you would be using a lab for and preparing samples for. I'll just talk a little bit about immunoperoxidase, electron microscopy, and some of the molecular techniques. But I'm going to concentrate primarily on blood work, histopathology, and microbiology. Autolysis is the diagnostician's nemesis, as I've written here. It's a progressive degeneration of tissues as an animal after an animal has died, and the longer autolysis goes on, the worse the condition of the tissues, and the harder it is to look at it microscopically, to deal with it in terms of microbiology, because in addition to breakdown of tissues, there's also invasion of microorganisms, and many of the pathogens that we deal with are not strong competitors when they're faced with common E. coli, common gut bacteria, common environmental bacteria, and can often be crowded out the longer the time extends from when the animal has died until a sample is taken. This was an unfortunate situation where the practitioner was doing everything right, but it went all wrong. This is a little piglet that the practitioner, they're having a scours problem in a herd, and the practitioner euthanized this piglet, put it into a black plastic bag, into a box, and put it on the Greyhound. At that time, Greyhound was carrying animal samples, shipped it to the lab. It was at the lab within 3 or 4 hours. And it came in swollen and rotten like this. The problem was that the animal had been euthanized and put into the black plastic bag right away and then shipped off. It hadn't cooled down. And as a result, the normal body temperature after death actually increased as the animal started, as the bacteria in the gut fermented. And because the animal was in an enclosed black plastic bag, it got hotter and hotter in there. And autolysis was actually faster in this case than if the animal had been left for an hour or two to cool down and then shipped. It's just an example of where somebody tries to do everything right, get the sample into the lab as quickly as possible, and it just didn't work out. But the basic idea is to try and get, if not the sample into the lab as quickly as possible, the sample into a fixative or into the cooler or the freezer or whatever happens to, whatever is needed, to try and get it in there as quickly as possible after the death of the animal, so that the condition of that sample, as I've said before, is as close to possible as it was at the time the animal died. So that any liver samples you take, so that any microbiology that you take is as close as possible to the situation at the time that that animal died. The problem with autolysis, not only that it causes degeneration and loss of cell structure and so on, but it can also mimic certain conditions, certain pathologic conditions. And two of these that are most striking are pulmonary edema and toxic damage to parenchymal organs. Dr. Bert Stevenson years ago did a really interesting little practical experiment at Saskatoon. He had a fresh calf that had been euthanized, and he put samples of lung out onto the table, and every 6 hours for about 42 or 72 hours, he took one of those samples and fixed it for histology. And it's really interesting because as the time went on, those lung samples that had all been the same, when they were taken out of the animal, went from being normal lung in the first sample that was taken to appearing to be severe pulmonary edema at 24 and 48 hours and onwards. And that's due to leakage of tissue fluids, to breakdown of blood, and they were very difficult to differentiate from the true thing. And so that's one of the problems with autolysis. Another is that the degenerative process in the kidneys and liver in particular can mimic the effects of certain toxins. And so it's really important to know that the sample that you're looking at under the microscope has been taken very shortly after the death of the animal, so that you know that you're really looking at something significant and not an artifact. And so that's the that's kind of the thing that the diagnostician has to rule out at first is, am I looking at an artifact or not? So when you're looking at something, ask, is it normal? Is it an artifact? This is an example of a normal structure. This is the stomach of a hippopotamus. And yet, if you look at this stomach superficially, with especially this large reddened, thickened area, you would think this animal has a rip-roaring gastritis. There's some lymphoid nodules here on the surface, the dark red, angry-looking deep pits. You might even think these are ulcers if you didn't really look closely at it. This is absolutely entirely normal. And so ask yourself, when you're looking at tissues, am I dealing with something abnormal, or is it an artifact? Now, if you're not sure, by all means, take samples from it and have it looked at, and ask the question: is this something real, or is this just something that I happened to come across? One of the other things that that can be confusing if you're looking at lungs on an animal that's died and been lying on the table for any period of time. Of course, the blood drains the lower areas of the body, and this is can be confused with pneumonia or pulmonary edema because of the appearance of that downside lung, when in actual fact it's just normal gravitation. Pigs, the same thing. They'll because they don't have a heavy hair coat, you can see the skin easily. They'll have blotchy red patches on the downside, and as a result, you might be fooled into thinking that that in fact there's something wrong there, when in actual fact it's a normal process. So just keep that in mind when you're looking at things. Is it a normal structure? If it's not normal structure, is it an artifact of some time that's being created by the way the animal was handled, the way it was lying, by the circumstances? So the first point of entry to a lab is to send in a history. History should be clear and concise. One of the things that is very tempting, I've noticed, for particularly in small animal practice, is because of all the computerization, it's just very tempting for the tech to push the print button and print off the entire clinical history of the animal and send that in with the samples, whether it be blood or anything else. That's okay, nothing wrong with that, but it would be useful to have a couple of statements about the current disease condition. In other words, it may not be very important how many vaccinations the animal had 5 years ago. What's the current problem? Now, sometimes that's quite evident from the history, but sometimes it isn't. So a clear and concise statement of what the problem is, what the clinical signs are is quite important. Secondly, identify the animal. And if there are ear tags, if there's a tattoo, name of the animal, great. But if there's something physically on the animal, color, whatever, that will help identify it, if it's an entire animal that's going in, or if it's a sample, it's important for you to be able to link that back when the report comes back to the lab. And it's surprising how often, because the people in the clinic are familiar with the animal, they know it. Don't forget, it's not the only case going into the lab that day. And it's important that when you get the results back, they apply to that particular animal. That's a lot more easy now due to barcoding than it used to be, but an important point. Particularly in large animals, but also to some extent in small animal practice, make a comment about the environment if it's relevant. And certainly in your looking at the case, stand back first and look at the environment that the animal is in before you do too much with the animal. The reason is that there are often environmental clues to particularly in large animals, as to what might be happening. For example, in southern Alberta in the springtime, minus 20 degrees at night goes up to plus 8 or 10 in the early morning or mid-morning. That will sometimes precipitate outbreaks of hypomagnesemia in older cows. So knowing what it was like the day before, if you're thinking of that type of condition, mention that in the history. One of the complaints I have with the trend now to larger not multinational labs, but big labs, cross-country labs, where work is done in many different places, it is a problem that the diagnostician probably doesn't know, particularly for large animals, the area that the animal samples are coming from. And one of the real advantages in the I hate to say it, but old days when labs were more local, was that you had local people who knew what the weather was like yesterday or last week, or what the growing conditions were in the crops. They knew, for example, in Alberta here, with Alberta Agriculture, when they were doing pathology, all of those pathologists knew that mineral conditions of the gray wooded soils where they were located in Alberta, that's all really important stuff in large animal practice. And a lot of that is lost now. So you have to help out, especially in large animals. You have to help out that diagnostician by putting a little bit of information about the environment and the effects it might have on the handling of a case or the diagnosis of case. Nutrition, same thing. Clinical signs, all important. Don't have to be long and detailed. If you're not sending in the animal's history from a computer, 2 or 3 lines sometimes is all you need to put in that will draw a succinct expression. And then I come to what I call the question. And what I mean by the question is you or the if you're an RVT, the veterinarian you're working with, or the client, or all 3 of you, will have something that you need to know about that animal. Something that's the most pressing question, or and it might be something simple. How did it die? Not sure. Sudden death. What's the cause? I think that we may have rhodococcus in the foals. Please follow up. That's the type of thing that is really useful for the diagnostician. Again, don't forget that that you are the person who's seen the animal and is able to direct some of that technology that's going to be put to the laboratory. And to show you that this isn't an insignificant point, I have to confess that at one time I was brought 2 yearling calves from a ranch in southern Alberta, in the foothills to the west of Calgary, and I did the animal, the owner just wanted a postmortem on these calves, and so I did postmortem. I spent most of the afternoon going through these calves. The owner had shot them in the head, so I assumed, because that's very often what an owner will do when they sacrifice an animal, large animal, to bring it into a diagnostic lab or a veterinary clinic for necropsy. And at the end of the afternoon, I was stumped. I couldn't find anything. So I phoned him up and I said, look, can't find anything significant in these calves of yours. Could you tell me a little bit about your farm situation? And he said, I thought they were shot. And I said, well, of course they were shot. You shot them in the head. He said, no, I didn't. He said, I found them dead underneath a sign that said no hunting. I just posted my land, and I think somebody came out and maliciously shot my animals. Well, right now, we're not into just a regular necropsy. We're into a forensic investigation, right? Luckily, those animals were still on the table when I was talking to him. So suddenly the whole postmortem changed to retrieving the bullets, describing the wounds, all that type of thing for a police report. And yet that was never mentioned at all until I called him up. And so I made the wrong assumption on that case. I shouldn't have. It's a common assumption, and he made the assumption that I would know that what to look for. So really important that there be a clear question, or questions, plural, that are directed to the lab. So moving on a little bit, histopathology is, I'm going to spend a little time talking about histopathology because it's one of the major things that you'll send into a laboratory, and there's some kind of principles behind it that will help you get a much better result if you keep them in mind when you're collecting the samples. And so, as I've said before, and I'm sorry to sound like a broken record on this, but it is important. Make sure the sample is preserved as close as possible to the way it was in life. handle it as if it was a surgical specimen, and then fix it as quickly as possible after it's being taken. And so there are two main fixative classes, just as a general idea. One of them cross-links proteins, and the other coagulates proteins. Now, this is somewhat important because it can interfere with other tests. So I'm thinking here of things like immunoperoxidase techniques. A cross-linking fixative is formalin, for example, is a cross-linking fixative. It cross-links proteins, and by doing that, it stops the process of decomposition. The coagulating fixatives will denature proteins. And rather than cross-link them, they denature them. And again, they stop the process of decomposition by denaturing them, but they render those proteins less useful for other more intricate laboratory tests. And just so you have some idea what happens to a piece of tissue when it goes into histopathology processing in the lab, this process takes probably, depending on the cycles that are run, it'll take 12 to 24 hours. First of all, you have to dehydrate tissues through a series of chemical solutions, and this is to allow the infiltration of wax. Now, the reason you want to infiltrate wax is if you think about tissues that, say, fresh tissues that you might take at surgery, surgical samples, tumors, or postmortem samples, they have a certain resiliency, and they also have different consistencies throughout. So, for example, brain is uniformly soft throughout because it has no innate connective tissue of its own other than the meninges, whereas liver has strands of connective tissue, particularly pig liver. And so you've got alternating areas that are resistant to a knife and then are quite easy for a knife to cut through. But what that does is it creates an unevenness that tears the tissue when a knife is cutting through it. And so in order to cut small enough sections to look at under a microscope, you have to harden the entire tissue to the point that not that it's excessively hard, but that's resistant enough uniformly for a knife blade to go through and cut a very thin slice. And so wax infiltration does this. And so you have to dehydrate so that the wax, being a lipid, can infiltrate the tissue. Then you embed the tissue in a paraffin block. So now you have a solid block of paraffin which contains a piece of tissue that also is solid, completely infiltrated paraffin, so that the microtome knife can go through it and cut a 5-micron section. 5 microns is the usual thickness for a section, a tissue section. Certain very specialized techniques using plastic will cut a 1 or a 2-micron section, but those are not, those are used in tumor research often quite a bit, but not commonly in a routine veterinary diagnostic lab. And then the paraffin is removed. So you reverse step 1 and you essentially rehydrate the tissue by removing the wax. And then this allows the tissue to be stained. It can't be stained while it has wax in it. And so the section is stained and then made available for examination. It's important to know that because that gives you some understanding of the way the tissue is handled. And the better the sample that they get to work with, the better it looks when it gets onto that microscope slide. So just talk about a couple of the principles of fixation. And one of them is that the rate of penetration of a fixative will determine the size of the sample that you want to put in. And this is, if you get nothing out of this seminar, then this one or two principles of fixation, you'll have done well. And the reason is this is probably where most histology doesn't go wrong, but could be better. Tissue samples are too big. And as a result, what happens is as a tissue is penetrated by formalin, or I'm going to talk about formalin almost exclusively, by the way, because that's the best, in my opinion, the best all-around fixation for general veterinary practice. I'll get onto that a little later, but I'm going to talk about formalin. Formalin penetrates tissues at the rate of about 5 to 8 millimeters in 24 hours. And what that means is that if you take a large piece of tissue and put it into a formalin sample, the formalin starts moving in at 5 to 8 millimeters from each of the exposed surfaces, but the autolytic process still continues in the rest of the tissue until the formalin gets to it. And so if you have a tissue the formalin doesn't penetrate, say for 48 hours, you'll actually have formalin penetrating ultimately into tissue that's already rotten. The other thing that happens to keep in mind is that as the formalin penetrates tissues, because most tissues that you're dealing with are at least 70% water, and tissues from neonatal animals, young foals, puppies, calves, are probably closer to 85% water. That tissue water is being displaced by the formalin, and it's going back into the solution and is diluting the formalin. And so although you began with a 10% neutral buffered formalin solution to start fixation, within a very short period of time, you're down to 3 or 4% because of this displacement of tissue fluid. So you have to submit samples that are of a small enough size that they can be fixed properly within 12 hours or so. And that means they should probably be no more than 1 centimeter on a side. So a centimeter cube is a good rule of thumb. And that will allow, if you have a cube that's 1 centimeter, that will allow within 12 hours or so, you will have complete fixation because you've got formalin coming in at 8 millimeters in 12 hours from all different sides. You'll come very close to having complete fixation in a reasonable period of time. Now, in order to overcome the dilution effect, there's something else you have to do. So you want a small piece of tissue, and you need 10 volumes of formalin to every volume of tissue that you put in. So if you put in a 1 centimeter cube of, say, lung tissue, you need 10 mils of formalin. Now, for most surgical specimens, and if you're only taking 1 or 2 histology samples from a necropsy, then the standard jars that are 60 mils or 120 mils will be sufficient. Don't forget, though, that those jars, if you buy them pre-filled, they may be 120 mil jar, but they've only got 50 mils or so of formalin inside. So you have to reduce the amount of tissue that you put into those jars based upon the volume of formalin that's in there. But you overcome this problem of time of fixation and dilution of fixation by decreasing the size of the sample and by overcoming the effect of dilution. Now, I'm going to continue on with this for a while, but we've come to an hour. I'm just going to stop the sharing here and see if there's any discussion or questions, or maybe somebody wants to grab a cup of coffee or something. So let's go to the questions. Wow, but I'll just start at the top here and see what I can do. Okay, just running through everybody's name. And I'm sure at some point we'll get to, okay.
There was somebody that was wondering what rat tooth forceps were.
Oh, I'm sorry. The forceps that I showed with the teeth are referred to as rat tooth forceps. I'm not sure how they got that name. Rat's teeth are usually a bit longer than that, but that's how they're named. So rat tooth forceps are the ones you want to use. Okay. I'm about halfway. I'm seeing everybody's name. I haven't got a lot of questions yet. Okay, if we have a large tissue, you just anticipated, Connie, what I was going to get to after the break here. So so there we go. And then the next one from Leanne. If we do 1 centimeter cube for 10 mil formalin, we have 50 mil containers. Would your add extra cuts just have surplus fluid? Okay, excellent. I would say you want surplus fluid. This will be partly answered in my comments to Connie's question. And also I'm going to talk about special circumstances. There are some circumstances in which you can submit larger pieces of tissue, and there's certain ways to handle those, okay? And then Kyle, same thing, essentially Connie's question. I'll get into that as soon as we reconvene here. Are there any verbal questions from anybody right now? I'd be happy to handle anything right now. Okay. Does anybody need a bio break, or shall I continue on?
I'll make you a question.
Sure.
If we have a bigger sample, could it be, I talk in Spanish, but I'm trying my English. If we have some different type of organs, as you talked about lungs, does it accept a bigger sample if it's a lung, or if it's a brain, or if it's any other?
Yeah, I'm going to talk about that. And in essence, the answer is take multiple sections, multiple smaller sections. That's the basic answer to this question, but there's some more to it than that. So I'll get into that once we start again. And,
okay.
Yeah.
Thank you.
Someone texted me a question.
Sure.
About when we have when we're doing a necropsy or collecting samples from a patient at a later time, should we be collecting it when they're still frozen, or do we defrost completely? That's
actually a really good question. Quite frankly, it doesn't matter. When the animal is frozen, there's going to be some artifactual damage caused by ice crystals that form, and by allowing the animal to thaw, that doesn't really change the effect of the deformation. So I would say if you want to look at the organ and select various areas, you might let it thaw out. But you don't need to. You can take it as a completely frozen. And that leads to another question, and that is what happens in really cold weather, like we're having now. If you're, say, shipping your samples off to a laboratory in minus 30-degree temperature, the courier's van may not be heated, and so that sample could freeze. And so my answer to that is fixed formalin tissues are more resistant to the formation of ice crystals, the effects of formation of ice crystals, than fresh ones. And it's simply because of what I mentioned, the way formalin works. It cross-links proteins. And so in actual fact, it's forming a cross-linked mesh of that tissue. And so my advice in those situations, really cold weather, is hold the sample in your clinic, maybe for 24 hours to make sure it's properly fixed, and then you can send it off. And if it freezes on the way, it's less likely to suffer artifactual damage from freezing than if you sent it right away before it had fixed. So I think with that, I'll go back and we'll start talking about the Sorry, was I muted there? No. Okay, can you hear me now?
All is good.
Yep.
Okay, good. Sorry, I got a note there that I was muted. So now to answer Connie's question and the other, Maria's question as well, there's no limit to the number of samples that you can take from any particular organ. And so in large animal practice, the way you get around this problem of cutting maybe just a 1 centimeter cube is to take multiples. And so think of where you want to take them. You can do a really good job on, say, a large lung, say an equine lung, by selecting your cubes from specific areas. You'll probably want to have one normal area. You'll certainly want to have an area that is affected with whatever the process. If there are different colors or different consistencies of lung tissue throughout, if it looks like it's embolic, you can take cubes from each of several areas. You can also improve the data obtained by making sure that if there is a distinct demarcation between affected and relatively normal looking areas of the organ, say the lung with pneumonia, very often there will be a line of demarcation between the edge of the pneumonic tissue and the more normal tissue. Take a sample that straddles that across that junction. Very often in advancing diseases, such as a pneumonia, lesion. The same for things that you might find in liver, areas of necrosis, damage in the liver. Take a section that goes across, that bridges across between the normal and the abnormal tissue. And here you can cheat a little bit. If you have a tissue that's maybe cut a section that's 2 centimeters long and only half a centimeter wide, you're going to get the same degree of fixation, right? You're just narrowing one of the dimensions and enlarging the other, and it's the narrower dimension that will result in the fixation. So as long as you cut something that's maybe 8 millimeters thick, it can be longer than my rule of thumb. If you're dealing with tumors, you'll want to have at least a section from the edge of the tumor. If it looks like it's breaking through a capsule or advancing somewhere, you'll need at least one. I'll actually talk about tumors a little later as a special item. Think also the anatomy. Lung is a beautiful example. It's got a very specific method of organization. You have an airway. Beside the airway, there's an artery or an arteriole. There's a vein. There's a nerve, and then it branches out into the alveoli. So if you take a 1 centimeter cube and center it on an airway, a smaller bronchiole, for example, you will have all of those structures included in your 1 centimeter cube. And so one slice will give a picture of the entire respiratory apparatus at that particular point. And if you can do that with the pleural surface as one of the sides of your cut, in other words, if you do that just under the pleural surface, you'll also have the pleura in there and the subpleural area to examine as well. And so by thinking about the anatomy of the organ, you can actually increase the anatomic areas that are being looked at on one particular slide. And so keep the anatomy in mind as well as the number of samples. So like I said, there's absolutely no limit to the number of cubes that you can send in if you're not sure on an animal. But make sure you got enough volume of formalin, of fixative to accommodate. Now, I'm going to show some of the perils of not doing that in a minute. Just to give another example, the lung is an organ that has a very specific structure. The liver has a very specific structure. So if you center a section on a lobule, either a lobule or use one of the portal triads, doesn't matter. Either way, center it on that, you'll get a good section of the entire metabolic apparatus of one or more lobules in that liver. Include the capsule and bonus. Kidney has a little different organization, and that can be handled by one of these longitudinal sections. If you take a section from the medulla out towards the cortex and only make it 8 millimeters wide, but a couple of centimeters long, you can probably include a fair amount of the anatomic area of cortex or medulla, or do one in the cortex and one in the medulla, and you've got both anatomic areas of the kidney in a couple of sections. So that's useful. Spleen is homogeneous. A section should be based on wherever the lesions appear for something like spleen and other organs. And the smaller an animal is, like pocket pets, or if you're dealing with rats and mice, you can actually take the entire organ and fix it, because in many cases, certainly with mice, the organs are, with the exception of liver and a couple of other things, they're all less than a centimeter on a side anyway. Just one other tip for those of you that might be working with rodents or in lab animal practice, mouse and rat lungs are a bit different than the other mammals in that the left side is a single lobe. Most mammalian species have 3 lung lobes on each side. Rats and mice only have 1 lobe on the left side. Therefore, if you section the just take the entire left lobe of a mouse lung and fix that, one section cut properly by the histology lab will in fact give you the entire lung on a slide, and the same for a rat lung. And so you can actually make one section that has the entire lung on it from those species. I know most of you won't be dealing with those, but that's something to keep in mind. I'm going to speed up a little here because a lot of this is not particularly important in general practice. I said 10% neutral buffered formalin is the fixative. I believe for general practice, that's the only one you need. It handles, based on my experience, it's easy to get. You can mix it up yourself if you want to, and that manual is a recipe. You don't need to, because it can be bought by the gallon from Fisher Scientific and other places. But it handles everything that you need to do in general practice. Every now and then, and particularly in working with eyes and with reproductive, particularly in equine reproduction, you will hear about Bowen's and Zenker's fixatives. My experience is these are both difficult to work with because Bowen's uses a lot of alcohol, and so it evaporates. So you've always got to be mixing up and keeping it fresh. Zenker's contains traces of mercury. I don't think you want that, and it doesn't have any advantages over neutral buffered formalin. These two, Bowen's and Zenker's, are fixatives that don't penetrate very rapidly, and so they don't have the advantage of rapid penetration, but they do fix surfaces very nicely. And so that's why people recommend them for things like uterine biopsies in mares and eyes, because they fix retinas very quickly. However, my experience is that uterine biopsies look just the same, whether they are fixed in Bouwens or in formalin. And the eyes, if you do an incision in the globe of the eye when you send it into the lab, that's usually enough to allow sufficient formalin penetration that you get good fixative. Mirsky's is, you probably don't hear much about it anymore. It was suggested as a replacement for formalin because it is non-toxic. It's based on sugars, but Mirsky's degenerates after about a week, and the fixation value decreases quite considerably. Whereas formalin, you can put stuff in formalin and you can pull it out and trim it and look at it in 10 years if you want to. I should mention Canadian dangerous goods regulations right now, because I may not get to them later on. At one time, formalin was considered a dangerous goods. This is when the regulations were very first proclaimed. It was quickly realized that it wasn't that dangerous, and now the amounts that you would use to ship to a lab or to move samples back and forth are not considered dangerous goods and not covered by the regulations. Now, unless you're shipping 50 kilograms of formalin, it's not considered a dangerous good. So you don't have to worry about that for those in your practice who are handling dangerous goods or have dangerous goods certification. I think we already covered this actually. The fixative that you use, formalin, determines the thickness of the tissue. Cut multiples and be aware of the anatomic areas. Include as many as you can within the sections that you cut, because you can get the best information back from those. So here's the proper size. This is a really old slide, but it's a good example of my bluff being called. I was pontificating once about the size of tissues, and so our AHT, this was at the Airdrie lab when it was a veterinary lab, she called my bluff. She went over and grabbed a jar of tissues that I just put into formalin and put in for processing, and brought them out here and slapped them down by a ruler to see if I was living up to what I said. And luckily I came pretty close to passing the test there, but it's good that you have texts that keep you honest from time to time. Here's an example of things gone wrong. This is from a practitioner who wanted this entire kidney examined, one of the pathologists to see the entire kidney. And you can see what's happened here. It's been put into a coffee jar, which at the time looked like lots of formalin, but there's so much decomposition that's been going on that's actually floating now in that formalin, and you've got gas bubbles that are forming. And if you take the kidney out and just slice it, you can see here what I mean by the effect of dilution. The formalin in this case was only able to penetrate through to about maybe half or a little more of the cortex of that kidney, and the rest of it is absolutely fresh kidney tissue, which has gone rotten. None of the fat's been affected. So this is what happens if you put too large a volume into too large volume of tissue into too small a volume of formalin. And so again, the way you get around it, cut multiples. Same thing here. Here's a lung that went into a container, and in this case, I sliced it when it came out. It came out whole. This whole lobe came out, and here's what it looks like on cross section. It's fresh, except for the outer centimeter or so. And so there was only enough formalin in there to fix that for perhaps 12 hours or so. Now, here's something else that you should be aware of. When you fix a tissue, as I mentioned, you get cross-linking of proteins. And so fixation solidifies an otherwise soft and pliable tissue. And here's a lung, perfect example. This lung would have been quite soft and pliable when it was put into the jar. Not a narrow neck jar, but nevertheless, it would probably have to be squeezed in and then it fixes inside the jar. Even though it doesn't fix very well, it fixes and it hardens, it won't come out. There's no way you can get that lung out without cutting it up and damaging it. And so in order to try and get the lung out entire and work with it properly, the temptation is to smash it. And that provides a hazard, which you can't overstate. We had a lab tech at Edmonton, Dave Moreko. I don't know if anybody remembers Dave, but he actually cut one of the tendons on a finger quite severely doing this to try and retrieve one of these samples. And so again, the answer is, first of all, use a plastic container. Plastic containers are much safer than glass in transit anyway. With occasional exceptions, you want to use plastic. And if you have to use glass, and if I have enough time to get on toxicology, I might talk a bit about that. Wrap it in duct tape so that the whole container, if it breaks, is held together at least, and that the pieces of glass don't fly all over the place or end up throughout the package. Anyway, this can be solved by using smaller tissues. Now, although I've complained so much about partially fixed tissues, they can be salvaged. And here's an example of one that's almost fixed, just didn't quite get to the middle here. And so this is liver, which luckily is a fairly homogeneous type of tissue. And so the laboratory technician can just cut through the fixed parts and make the section that way. So just a cut through the fixed area, avoiding the unfixed middle part, and you can make a decent microscope slide. The problem with this would be, if you think back to that kidney that was in the jar all by itself, all you would be able to look at would be the outer part of the cortex that was fixed. So in other words, this is not ideal for anatomic reasons, because you may not have the complete anatomic unit that you want to look at fixed and available to look at, but you can salvage these. Here's just another example: incomplete fixation. A great idea, send a heart in, have it looked at, but and even in this case, the practitioner did try and increase the fixation by, if you notice, there are incisions in the left and the right ventricle. And the idea there was to incise the ventricles to allow the formalin to go in, which is great. But it still wasn't a big enough volume of formalin and just too much tissue to fix. And so you can't see very well here, but the middle of this cardiac muscle all through is unfixed. So not to belabor that, there are some special circumstances, as I mentioned. One of these is with pocket pets, small pocket pets. A lot of practitioners don't feel comfortable looking at tissues or doing postmortems on pocket pets. And so what I advise them to do, this is a mouse, you're looking down onto a plastic container, has a hamster in it from the top. And so what you do is you open this animal up so that all of the organs can fix. And this comes back to the point that I made earlier, with small pocket pets, because their internal organs are generally less than a centimeter in length or width, you can get by fixing the entire organ. In this case, you can actually, by opening the chest, opening the abdomen, get by fixing the whole animal. So you prefix it in the clinic in a larger volume of formalin, and then you put it in a smaller volume and send it into the lab already fixed. That's not ideal because there are artifacts and changes caused by fixation. But if you really want to get a postmortem done on one of these small, and this would work for a very small puppy, perhaps a small kitten, you can use this technique and get a sample in for a postmortem by a pathologist. Always talk to them first beforehand, let them know you're going to do this. Now, I also mentioned in one of the questions, I think, Maria, maybe that was part of your question, I can't remember, but the is what to do with large masses that you want the laboratory technician or pathologist to see in its entirety. And this is what you do. I'm sorry, it's not it's a pretty grainy picture, but I think you can get an idea. This is a tumor mass that was removed from a dog, and the practitioner was very concerned, first of all, because of its size, secondly, because there are different colored areas in here, and thirdly, there was some evidence around one of the edges, I think it was up around here, that, that this tumor might be eroding through the capsule. And so this practitioner wanted the pathology lab to see the whole mass. And the way you get around this is just as we've done here, we've sliced this at approximately 1 centimeter distances, almost like a loaf of bread, but the cuts haven't gone all the way through. And so it's all attached at the far side that's down from the camera here. So you can open this up like a book. And yet, by using a large enough volume of formalin, you can fix this pretty well, so that there are, all of that tissue is available for the laboratory to choose what they really want to look at, and to go back to it. If on their first sections they want to look at some more, they've got the whole thing there ready to look at. The trick here is also, as with that pocket pet that I was talking about, fix them in the clinic first with a larger volume of formalin, and you know, hold it. You might have to change the formalin. You might have to change it after 24 hours, put fresh formalin, change it again, and then send it into the lab in a smaller volume of formalin. That'll work. And this is this actually is the preferable way to receive tumors where you really think they're not homogeneous, or you want different areas looked at and the edges looked at, because then the whole thing is available for the pathologist to work with. The brain is also an organ that can be fixed whole, even large brains. And the reason for this is, as I alluded to before in talking about trimming tissues with a microtome knife, the brain does not have any connective tissue, no collagenous connective tissue. It does have supportive structure, but it doesn't have collagenous connective tissue if you strip the meninges off. And so you can fix the brain whole. Now, there are certain neurologic conditions where this is desirable, others where it isn't. For example, in such things as ITEAM or polioencephalomalacia or lead poisoning in cattle, the lesions are usually visible grossly, and a section can be taken from a lesion and fixed and sent in as we've discussed. But there are other conditions that are diffuse, or there may be certain research investigations in which you want to fix the brain whole. And this is done by taking the whole brain out and putting it into a 4-liter bucket of, an ice cream bucket is ideal, one of the large ice cream buckets of formalin, and just letting it sit for 24 hours, stir it a little bit, maybe from time to time, dump the formalin, put in another liter or another 4 liters, let it fix probably for 48 or 72 hours, and then it can be sent off to the lab in a smaller volume of formalin, and there's a pretty good chance it'll be pretty well fixed. I included this one. Here's another one that's not well fixed, but anyway, the key there is the fact that it doesn't have any natural barriers to formalin penetration, and so as long as you keep putting fresh formalin in there, it'll keep penetrating right through the tissue at the same rate that it normally does. So that's one of there are other certain techniques in neuropathology where you know, if you put an entire brain into formalin, the regular 10% formalin, it'll sit on the bottom and it will flatten slightly. Well, for a really important neurologic workup, you have to layer a layer of 40% formalin on the bottom and then 10% above it, and then float the brain in that. But that's way beyond anything that you'd be doing in general practice. So just it can be done, but I wouldn't worry about that for sure. A few comments about other tests now. Bacteriology, or more generally microbiology. Make sure you package samples individually, because this is a well-packaged sample. Actually, from years ago, it was one of my classmates sent this in. It's from a foal that had a septicemia, but it illustrates a couple of points. First of all, because it was a septicemia, in order to prove a septicemia, you need to get the same organism out of 3 different organs. So in this particular case, he was working with high-end racehorses. This was really important diagnosis. So each of these samples from this foal were individually packed. So there's no cross-contamination. And don't forget, these are the World Pack bags, but most of these plastic bags are sterile until you open them. So you can take a tissue and drop them straight in, and no problem. But because these tissues were dry, or appeared dry when they left his clinic, but look at how they arrived at the lab. And this is no fault of anybody. This is just the amount of normal fluid that's in a neonatal animal's body, and this will leak out in transit. So just be aware of that. Package it so that if this leaks out, it's not going to leak through the package. I'll give you a couple of examples of situations where that didn't happen. So avoid cross-contamination and send them in. Most of the time you're sending swabs. Easy thing to do. Usually, the swabs have their own tube with transport medium. You put them in the transport medium and off they go. Some even have their own mailers. Just a quick note on transport medium in microbiology, and also for molecular techniques, the swabs that you would use for PCR testing, as well as those that you use for bacterial culture. The transport medium is not a growth medium. All it does is preserve organisms, and so it's not the same as plating it on a growth medium for identification. All it is to preserve. And so if your swab is contaminated, those contaminants will also be preserved as it goes in. So although you've got good protection from the transport medium, remember it's only transport medium, and make sure that sample is as clean as possible when it goes in. As little contamination. And if you're working with a fresh tissue and you want to make sure that you've got as good a sample as possible, use a hot knife, heat a knife up on a burner or something, and sear the surface before you stick your swab in. And that will help to reduce contamination. Now, having said that, there are some creative ways that you can ship the samples in for microbiology. This is a case of a sample that came in for a mastitis. This is a really bad E. coli mastitis in a cow. And the practitioner aspirated this large volume of material, purulent and serous debris from the mammary gland of this cow, and he was wondering how to send it into the lab. Well, the more you fiddle around with it, the more chance of contamination. And so in this case, he very astutely recognized that when he took the when he took the syringe out of the package, it was sterile. And so as long as he kept the syringe intact, it was going to be as sterile a solution as possible, or uncontaminated a solution as possible. So he actually sent it in to the lab, left the plunger, just taped everything up, put it into taped it into a package and sent it to the lab. Great thinking. That's a good way to do it. The only modification I would have done, which is here where it came in order to make it easier to pack, I'd have just cut the plunger off, just to make it smaller and easier to ship. and less danger that in shipping, the plunger could have been accidentally hit and some of the sample lost. But otherwise, this was a good way, a good creative way to send something in. And that also applies to blood and fluids as well. This is an example of the practitioner. Oh, by the way, all of these photos I'm showing you are real. None of them have been set up or fake. These are all samples that have come into a lab at one time or another. And so this particular practitioner put cotton wool in the bottom and the bottom, sorry, of these syringe containers, and the serum tubes fit in there nicely, and shipped them off to the lab. Those are well protected samples. No chance of those breaking in transit. And so again, make sure that the samples are protected, particularly where there's glass involved, so that glass doesn't break and not only contamination result, but your sample be lost, and there'd be danger to people handling that package. And that's a great way to send it in. I want to make a few comments about toxicology here. And I think perhaps just to highlight a few things, I'm not sure everybody realizes when they want to send samples in for toxicology. Toxicology is extremely expensive. There are not a lot of labs doing toxicology. There are even fewer labs doing veterinary toxicology. And the labs that do veterinary toxicology tend to specialize in a small number of tests each, spread out across. In Canada here, we have different labs that do different tests. And so you're going to have to work the phones if you have any significant amount of toxicology to do. One of the things that I encountered in doing necropsies on pet animals is almost always, if you get a large breed dog, say a German Shepherd or a Rottweiler, or the larger Labrador that lives on an acreage and dies suddenly, the owner will 8 times out of 10 think it's been poisoned, and they ask for toxicology. In the years that I was doing for kind of an on-call basis necropsies on dogs in Edmonton here for the clinics, and that was over about an 8-year period, I only ever had one dog that was poisoned, and it was an accidental poisoning, and the owners actually kind of knew it because it had gone out with them to the father-in-law's farm and gone roaming around. There was strychnine bait out. The dog started convulsing within about half an hour of them getting back in the car and driving home. All of the others, there was some other cause of sudden death. Nevertheless, toxicology can be done, but it's extremely expensive, and the owner has to bear the cost. And I'm talking, you can run off a bill of $1,000 doing toxicology very quickly. Strychnine testing is relatively cheap. Everything else gets expensive. It's very important, if you think you've got a toxicology case, to talk to the laboratory people or toxicologists. Barry Blakely at Saskatoon was a great source of information. Sorry, I just jumped ahead by too fast there. And I'm not being allowed to go back. There we go. For toxicology, it's very important to have an accurate description of the clinical signs the animal was showing, because this clinical signs very often will give you a class of compounds. So even though you don't know what the specific toxin is, you may be able to narrow it down to a class such as organophosphates, and that allows you to focus the testing. If you've only got a certain amount of money and it's really critical to find out, you can focus on that class of compounds. It's also very important for the lab to know if this is a potentially forensic case, because if it is, there's a whole bunch of other things that come into play. For For example, chain of evidence and the way the samples are handled. Certain tests are, certain techniques are not accepted by the courts for forensic toxicology. And so if it becomes a forensic case, it's very important that the toxicologist uses the right test, one that's being validated and acceptable to the court. And always be aware of the potential of cross-contamination in toxicology. It's very easy to do, particularly if you're shipping samples in, say, pill containers or something that's being used around the clinic. You'll have something else. You can seriously contaminate a toxicology sample. And glass containers are the one type of, or toxicology samples are the one type of sample that can probably best go in a glass container. They're easier to keep clean, make sure they're clean, and they're better for toxicology than plastics, which can leach out. I'm going to mention just a little bit of molecular techniques. Viral culture now is quite uncommon. There are still certain viruses that you need to culture for, but culture is slow and expensive and is being way overtaken by rapid molecular techniques, particularly PCR. So make sure that if you're collecting samples for PCR probes, that you use the correct molecular swabs. You can't use regular bacterial swabs. Don't use those. You need specific swabs. They look much the same with preservative material for PCR. If you do need to have viral culture done, you need to get those samples to a lab as quickly as possible. So distance is important. Sterility is critical because viruses will die out quite quickly. And be aware of the difference between cold and dry ice. Certain viruses will be killed by freezing. Others require dry ice. Cold packs will not freeze a sample. All cold packs do is keep a sample cool in shipment, but they very rarely will freeze anything versus dry ice, in which dry ice will freeze. But dry ice becomes a dangerous good. And so if you're shipping samples in dry ice, you are subject to dangerous goods regulations. Electron microscopy really isn't done anymore. And in fact, I'm just going to skip over it because I don't think in routine clinical practice you would do anything. I'm just going to talk for a couple of minutes on packaging, and then we'll go to questions. I just wanted to show you, and something I should have mentioned, if you recall that history sample, when I was showing or talking about histories, there was a photograph of a history which was torn and had blood on it. And I should have made a point then that when you're shipping the history to the lab, put it into a separate plastic bag, like a baggie or something to protect it, because if there is damage to the samples en route, they will leak and damage that history form, and they may even render it unusable. It also becomes a biohazard to the people that have to handle it, particularly if it's going through administrative support people that are typing or whatever. So make sure that the history form is in a separate bag, and some of these, certainly the biohazard bags have pouches on the side for the history. That's ideal. Keep the history separate from the sample. I just wanted to show you what can happen when samples are not packaged properly. This was on the government courier many years ago. This would never happen now. The dangerous goods people would be in like a ton of bricks on this one. But shipping samples between labs, this was actually between labs. And it was really poorly packaged, just glass bottles put in there. It got damaged on the way, and then it leaked. This is Government of Alberta courier package that was in the same van with this bag. And these are going to government offices. Well, you can imagine the outcry there was about this, and quite rightly. This should never have happened. But this is a really severe biohazard and just something to be avoided. So my point is, be aware of what's going to happen to your package on the way to wherever you're sending it. It leaves the lab in pristine condition, but as you saw with those full samples and some of those others, it can leak. Normally, quite normal leakage of body fluids. Make sure they're contained. You should have a solid container around your specimen, which then is packed in a layer of absorbent material. And there are lots of commercially available things, but even such a thing as newspaper or kitty litter will suffice. And then that's inside another package, plastic, or a sealed container that will contain any fluid that leaks out of the first package, if it does. Time for one more. Transport of dangerous goods legislation. As you're all aware, you have to be trained to send or receive dangerous goods. There are really two main areas affecting veterinary medicine, at least as far as diagnostics are concerned, is chemical formalin. You don't have to worry about that, but there are certain other chemicals that would be subject to dangerous goods. And diagnostic specimens. This is important differentiation. If you're sending a sample to a laboratory to obtain a diagnosis, then that's considered a diagnostic specimen, and it is not subject to dangerous goods regulations because you don't know what's in it, right? In other words, you don't know whether there's an infectious agent or not. However, if you know that there's an infectious agent, in other words, if you have identified and shown that there's a certain infectious agent in a sample, and you're sending that to a lab for confirmation, or in some cases it might be for regulatory purposes to CFIA, one of their labs, rabies, for example, that is considered a dangerous good and is subject to dangerous goods. So although you wouldn't ship it around, say you cultured anthrax, or you knew an animal died, you had evidence that died of anthrax, and you shipped a sample from that animal, that's a dangerous good. It's no longer a diagnostic specimen. If it's died, sudden death, you're sending it in for screening, then that's a diagnostic specimen. It's an important distinction that that can keep you out of trouble if you keep it clear. Now, I'm going to stop at this point because I've rambled on long enough. I might have more to tell you at some future event, but I'm sure you're probably all half asleep right now. But anyway, let's go now to questions, and let's have a look here. My thought of putting alcohol in cups once sampled and formalized for greater than 24 hours. That's not a bad idea. You're mixing your fixatives. I'm not sure there's any great advantage. The alcohol, of course, being in there to lower the freezing point of the solution. I think that would be okay, but I'm not sure that it's any better than just sending in the formalized sample. Alcohol should not, though, be used to fix tissues first and then ship them. And the reason is that alcohol produces is a dehydrating agent, and it severely dehydrates the tissue to the point that it can't, it's too stiff and rigid to be handled properly in the histology lab. Now, you might say there's a contradiction there, because alcohols are part of the process that's used to dehydrate, but the dehydration process in a tissue processing regime is a graded alcohol solution. A series of graded alcohol solutions are passed over or through, depending on the type of machine, the samples that you're working with, and so it's a different situation, and it is much more controlled. If a practitioner wants whole organs to be examined, would it better to leave as fresh or ship as frozen? You know what? I would rather, if they can get to the lab within 24 hours, or be refrigerated and shipped, in cool temperatures, I would rather have fresh tissues, to be quite honest. If it's going to be more than about 48 hours, they should probably be frozen. But even entire small animals, for example, cats, puppies, kittens, smaller pet animals that can be cooled in your refrigerator and then shipped with cooler packs within 48 hours or so to the lab are actually quite suitable and probably better. That would be my preference anyway, as a pathologist receiving those samples. Okay, those are all the written questions so far. Connie, I'd entertain any oral questions that anybody might have.
Does anybody have any great questions? This has been just so fascinating. Love the pictures, love the tips.
I normally say that I'm not the type of person that people want as an after dinner speaker because of my pictures, but given this crowd, I wasn't worried.
No, the pictures are great, and on the website that you'll get another link to, there's a great form for when you need to do a necropsy. We had to do one on a sudden death of an animal, and I downloaded it for our vet to do, and it was really helpful to make sure that we had everything documented, and also that it would provide us with an opportunity to think back after we finished our necropsy and figure out exactly what had happened. So it was really helpful. I encourage everybody to go to all the protocols that are there.
Yeah, I think that's a good point. Laboratories nowadays have all kinds of information on their websites. That's one of the beauties of the web, is that there's a lot of information available, and it can be picked up worldwide. That manual that I sent to UCVM, actually, believe it or not, the researchers at the Australian Navy picked it up and started using it. So you never know when you put something on the web where it's going to end up.
Hopefully they were using it for good, not for nefarious purposes. Well, thank you. There are people saying thank you in the chat, and I know some people have texted me saying how much they've enjoyed this and how wonderful it was. So Dr. Nation, thank you so very much for taking in your second month of quote unquote retirement. Thank you very much. Oh wait, there is another question that just came. Concerning freezing, had a fixed sample over the weekend, was told to add alcohol to stop it from freezing. It still froze. How can we stop this?
Oh boy, good question. You can't really. I'm afraid in some situations it's going to freeze. Alcohol is only going to work down to, well, it should work down to -80, but no, that's probably too far. -20. But once you're getting into really severe conditions and unheated vans, I think the answer is, especially if you're in a community that's remote from a major city and you're trying to get samples into a lab in, say, Calgary or other, Saskatoon. If you have a regular courier, get to know that person and buy them chocolates at Christmas, and then ask them to keep your samples in the cab where it's heated when they're driving. That's probably the best preservative.
That's great. That's great advice. Well, if there aren't any more, oh wait, does putting a sample into a styrofoam container help again?
It does for a while, but eventually, again, and it's all time dependent. and depending on thickness of the styrofoam, eventually even contents of a styrofoam container will freeze. But that's a good point. It will help to retard freezing, especially if you can get that sample then into the lab within a day or so.
And also another suggestion is that newspaper provides an amazing.
Yeah, newspaper is actually newspaper is a good insulator. Yeah, it is.
So there is a use for the Edmonton Journal.
Yes, there is.
All right, any last questions? Nope, just thank you. This has been fabulous. Thank you so very much. Everybody stay warm. -29 in Edmonton tonight. I'm sure it's cold everywhere else in the province. But this has been a great presentation, entertaining, informative, superb pictures. Thank you again so very much. And maybe Dr. Nation, we can get you back more again later, since you're so uninvolved and you can show us really cool, gross pictures.
Okay, well, thanks everybody. Thanks for your attention. I appreciate that. And I noticed that pretty well everybody stayed till the end, so thank you for that too.